I got to be on the ECT unit, which is the Electroconvulsive Therapy unit, which was super crazy. I got to see so many people get shocked. Hi everyone, welcome to my channel, or welcome back to my channel. My name is Bailey if you don't know me, and I am doing another week in the life of a nursing student, except this week I'm starting on Friday. It is currently Friday, and I'm starting on Friday because I have vaccine clinic for the COVID vaccines on Sunday. So I thought that I would start now and just kind of do a little intro for you guys, to tell you guys what I'm doing. So I have an exam next week. It's my last psych exam of the rotation, and then we're on to OB. And then I also have another psych clinical on Monday as well that I can bring you guys along to. And yeah, that is about it right now. I'm currently just going over some schoolwork, some prep use. I don't know if you guys know what that is, but it's basically just like NCLEX style questions, and then you have to take a bunch of quizzes over and over and over and over again until you get to a certain mastery level. So I have to take a bunch of those that are due this weekend. I also have to study. I think that's about it. Clinical on Monday got canceled like after 2 hours because there was COVID on the unit, so we didn't end up being able to be on the unit for our Monday clinicals. That's why we're going into the vaccine clinic on Sunday to make up for that. Nervous for the exam, excited to give more vaccines, excited to be done with psych and ready to be in OB already. Sadly, we got some news from our OB clinical instructor that we will not be full-time in-person clinicals like we were with psych for OB, and that's really upsetting because we were told that we were gonna be full-time clinicals. So we only get 2 in-person clinical days for OB, which is really upsetting because there's a whole lot to see in OB, and it's really hard to see everything, like all the, like a C-section, natural birth, NICU. There's so much to see in OB, and 2 clinical rotations is not a lot of time to see that. So kind of upset about that, especially since that was another one I was really interested in, but it is what it is. Can't be too upset about it because we're almost done with the semester, and then next semester we're supposed to be completely in person. At least we got an email from our school saying that we were going to be completely in person for next semester, so keeping my fingers crossed that that is what is actually going to happen, and that we will actually be fully in person. I am literally so excited and so blessed if we are allowed to at least have our last semester of nursing school be in person. That would be amazing. And also I'm hoping that means that an in-person graduation is also a possibility as well, because this semester they're still doing a virtual graduation, and that is just the saddest thing ever. Like, I do not want my graduation from nursing school to be virtual. So I'm really excited about that and really looking forward to hopefully being fully in person with a full in-person graduation and everything, but we will see. So yeah, I will just set you guys up and film a little bit while I study, and then I will talk to you guys later when something else exciting is going on. I'm currently, this is a different setup. I'm literally sitting on the floor. I don't know why, I just wanted to sit next to the door, and it's a really nice day. It's like 65, so it's like nice and refreshing outside, and yeah, so I just thought I'd mix it up instead of sitting on the couch. So that's why I'm on the floor, you guys, and yeah, okay, well, I'll talk to you guys later. Since it's Friday, we're attempting to make a fancy drink. What are you calling it? White Claw Wasted?
Just dump this in here.
You have to do it like upside down, don't you? What? Oh, did you put any ice in there, Coda?
No, it doesn't.
Okay, it doesn't look good because there's no ice in there. Okay guys, taste test time. So I finished 2 of my prep U's that are due. I got to the mastery level I needed to, but then as you can see, I still have a bunch more stuff to do. So, fun. But let's... Oh, we put it in the freezer for like 30 minutes. Make it a little icy. I have a bat straw because it's left over from Halloween. I don't know where I got them, but I just use them all the time now, even though it's not Halloween. I love it. That's pretty good. I give it a, well, also I'm eating tuna fish right now. Kind of weird, but whatever. And the taste doesn't really go very well put together, but
Oh my god.
8 out of 10. For now, it might go up soon later, but for now, 8 out of 10. So now I think I'm just gonna chill for a little bit and then maybe do some more homework later. We'll see. After this bad boy, who knows what I'll be able to get done, so. But it is Friday night, guys, so let me celebrate. I don't get a Saturday night because I have the vaccine clinic Sunday morning, so my only night to relax and drink and just chill. So that is what I'm doing, and I will update you guys when something else happens. Good morning, everyone. It is Saturday, and I am currently going over some lectures, but I don't know. I'm just like really not worried about this exam at all because I did so well on the last one, and I don't know, I'm just getting these vibes from it, and that's how I felt about the one before it too, and I ended up doing good on it. So I don't know why I feel like this, because normally I don't. Normally I'm freaking out thinking I'm gonna fail the entire time before an exam, but for some reason for my psych exams I'm like, I got this, I know this stuff. Like, I don't know. So I'm not really like as stressed as everyone else, and I don't really know if that's freaking me out or not, or should freak me out or not. Everyone was really stressed about the first one, and I didn't really feel like I needed to be for some reason, and then I ended up doing really good on it. So I don't know guys, I don't know, but I'm thinking about like the time I have to study for it. So I have today. Tomorrow I have the vaccine clinic from 8 to 1. Monday we have regular clinical in the hospital for psych, our last psych clinical. Then Tuesday I don't have anything to do, so that's gonna be a study day. Wednesday I have lecture in the morning at 11, and then I nanny 2 to 6, and then but I don't get home until like 7 because the drive is so long. Sorry, Maya's going crazy. And then we have the exam Thursday morning. So I have all of Tuesday, but just not like a ton of time to study, so I don't know if I should be freaking out more or not. Also, I've been really into The Sims. I've gotten back into Sim. I go through phases where I obsessively play The Sims, and then I don't play it for like months, and then I obsessively play it again for like a couple weeks, and then I stop and get bored of it, and then I don't do it, and then it just repeats itself. So I'm back into another phase of obsessively playing The Sims 4, and I really want to play that too because I just lost like my saved game on it, so I have to like remake everything, and that's gonna take forever. Kind of upset about, but also kind of excited because like the whole create a sim and like making all the stories and the backgrounds for all of your sims is like one of my favorite parts. I could spend forever doing that, so I'm kind of excited to like revamp everything and like take a different spin on certain sim stories. And also there's like new stuff out that I want to play around with, so It's like study for the exam, play The Sims. Study for the exam, play The Sims. Study, play The Sims. Study, play The Sims. Also, I have to edit. I've been really behind in editing, which is important because I don't have a video to go up next week. Study, play The Sims, edit. I don't know, guys. I am currently about to put a face mask on because I am going to get in the bath. So I like to take a bath before or the night before any clinical that I have because I have to wake up early, and I get a lot of anxiety around that because I don't like waking up early and I have a lot of trouble falling asleep. So I like to have a routine that kind of relaxes me, chills me out, you know? So I am going to be putting on the Ordinary AHA BHA little peeling mask thing. Everyone knows about this, and if you don't, you should try it because it's pretty good. And I just like to put on a mask, and then I do my full skincare routine, night skincare routine after I put this on. So sorry guys, my bathroom setup really is like bad. I gotta work on it, but this is it at the moment. So just put a little on my hands, rub it together, and it looks crazy, but it does some good work. So I will show you guys the products that I use in my bath. I already have it ready though, so like I need to hop in and it's gonna be room temperature very soon. So I use the Dr. Teal's foaming bath soothing lavender scent, obviously because I want to be going to sleep. Same thing for the Epsom salts, also lavender soothing scents. I also have different variations of the stress relief scent from Bath & Body Works that I love as well, that I'll mix in there depending on if I feel like it or not. Also the candles that I'm burning, oh, darn it. Okay, well this candle's done for because I just lit it and it's already not lit anymore, but this was the fresh cut lilacs. So I would burn that one, which now I have to replace with something else. I'm burning the Frozen Lakes candle from Bath & Body Works. That is a Christmas scent, but I just think it's like soothing. And then I'm also burning a stress relief candle. I don't want to put it out, but I just have my little setup. I poured myself a little glass of wine so that I can kind of like relax. I don't know if that's like a thing or not, but like my parents would always have a glass of wine before bed to like help them go to sleep, and I'm pretty sure I've heard that it'll like put you to sleep. Like one, you don't need to get drunk or anything, just like one glass of wine. So that's what I'm doing. And then I just turn the lights off like this, and it's like a nice soothing, calming, sleepy, relaxing environment. So there's that. And then I also get my clinical clothes out and set them out so that I'm not like scrambling in the morning, because it's really hard for me to like get up in the morning, like I said. So I make everything as easy for me as possible. And then also I just have like my Apple Watch charging here. And I don't have to prep a lunch actually for either of these two, so you guys won't be seeing that, but I have some footage of it in my other vlogs. But yeah, so I am just going to, it's about like a little past 9:30 now, so I need to get into the bath and start chilling. But I will talk to you guys in the morning. happy Sunday. So it is currently, my car clock is not accurate, so I have to check my watch. It is currently 7:20 and I'm on my way to Starbucks. So I don't know if I talked about this at all last night, but one of the things that really helps me get up in the morning is having something to look forward to. So that thing for me in the morning I found is Starbucks. I'm not obsessed with Starbucks. Like, I think it could be better. I think it could be a little less pricey, but it's a nice coffee, and sometimes, depending on how I'm feeling, I'll get breakfast as well. Just a little something to like do with my morning before I have to go do stuff for school. So it's kind of just something to help me like wake up in the morning and be like, okay, like if I get all ready fast, like the faster I'll get to my coffee. And
in half a mile, use the left 2 lanes to turn left on South Polk Road.
My breakfast. So I just wanted to let you guys know that I am going to get Starbucks. I left early, so I left like 20-30 minutes early, so I will have time once I get to the vaccine clinic to sit in the parking lot and eat and talk to you guys, chat with you guys for a little bit, and then drink my coffee and just kind of wake up a little bit more.
Turn right, then turn left.
So I'm gonna go in and get my coffee, and
Turn right,
I will see you guys in a
turn
minute.
right.
Yay! Okay guys, so I am finally here. I just got off the phone with my friend Shannon. She's running a little bit late, but it is 7:45, so I have about 15 minutes to chill and eat. I just showed you guys where I'm at. So as you can see, I'm at like a sports complex by the hospital, and they just kind of converted a parking lot here into a vaccine clinic with a bunch of tents and stuff, and area for parking your car for observation after you get your shot. All these people you just saw here are all lining up to wait to go in to get their shots. We haven't opened yet, obviously, because I'm not in there. And also another thing that's really interesting about today is that they just opened up for the 16 and older being able to get the vaccine now. So we'll be vaccinating a lot more people. Before that was authorized, we were vaccinating at least 2,000 people a day, if not more. So very exciting stuff. Anyways, for my breakfast sandwich, I just got the bacon, egg, and Gouda. I don't really know which one is the best breakfast sandwich. Don't ask me. I usually like to put ketchup on mine, so this is kind of disappointing, but it'll get the job done. There are also way more students from my college than there was the last time I was here, which is interesting. Nice. Maybe I'll see some more friendly faces. It's awkward because I'm sitting here looking out to all these people waiting in the line to go get their vaccine, and they're all staring back at me, eating, stuffing my face. This is a really good breakfast sandwich though, if you're interested. My coffee, I got the almond milk flat white thing. The almond honey flat white, something like that. But I get extra honey in it, and it is one of my favorites. Also, it comes with 3 shots of espresso in a grande, where normally the other ones I've seen are only 2, and I need as much caffeine as possible because I feel like it honestly doesn't even really work on me. Like, it's probably only like psychological. I'm like, coffee wakes me up in the morning, but doesn't actually, because I can drink like something really strong caffeine and not feel anything. And my fiance is really sensitive to caffeine, and he will drink something high in caffeine and literally like feel it for like hours afterwards and be like, I'm so jittery, I'm so like hyped up on caffeine. And I'm like, I wish I could feel that too. Anyways, so I'll be here till 1 o'clock today. And then the rest of the day is just gonna be, I have homework to get done, probably maybe a little more studying depending on how I'm feeling.
Like really regulated. And only if you're like going out on highways. Like if you're just staying in this little area in like the oil fields, you can
Say hi. Hello.
And sometimes he is.
Looking good, Shannon. Okay guys, we out here. Shannon's on the phone. So currently we just did first 3 hours over in the vaccine tent, and now we're in observation. So basically after you get the vaccine, you either have to wait 15 or 30 minutes before you can leave to be observed for any adverse reactions. So now we're just talking to people, verifying that they have all their information correct, and then we just watch them for the amount of time allotted and then let them go. And yeah, it's been super fun. I will tell you guys more about everything when I'm done because I'm still currently working. But yeah, we have an hour left, or maybe an hour and a half, depending on how long. They might keep us till 1:30, I don't know. But yeah, so I'm having a lot of fun, guys. I'm trying to get a weird mask tan. That's my goal.
Yes.
I actually did put sunscreen on my face today because of all my acne medication I use.
That's good though. That's good that you're wearing mascara.
Mascara. It's
I'm
good
so
that I'm wearing
tired.
mascara too. But anyways, we're having fun. Shannon, how did it do on your vaccines?
Did really good. It was really fun. And after like the first 5, I was basically running the show. I was asking all the questions, and they said penicillin reaction. I said, well, what kind of reaction do you get? And whatever, send them on. See ya.
Yeah, we're pros now.
Yeah.
But then in like a week or two, we
forget.
won't be pros anymore.
Be shaking to get the little
Yeah,
insulin
I'm
injection.
still shaky. I'm not even giving
I
vaccines
think
anymore.
it's a coffee. I really think so.
Maybe.
I have not had any coffee.
I literally told them this morning, I was like, caffeine doesn't do anything for me, so that's why I get 3 shots of espresso in my drink.
That's definitely the problem.
And now I'm like shaky and I can't stop, so maybe I do have a reaction, guys. I don't know.
I can perform brain surgery right now. That's baby
I mean,
shaking.
you can literally
That's
see
baby
the
shaking,
camera
that's not me.
shaking. Okay, guys. Well, I'll talk to you later.
Bye.
Good morning, everyone. I know it's been quite a while since I last talked to you guys. So I'll have a few clips from last night of me taking my bath. That's really all the footage I got. Honestly, I was so exhausted from being in the sun that I went home, took a nap, and then when I got up, I just finished all the rest of the homework for the rest of the rotation. So everything that's due, even after the test, I'm done with. I got all that done, and then I just got right into the bath and then went to sleep after that. I am currently on my way to clinical at the new behavioral health facility that we're going to. I'm running a little later than I wanted to be. Normally I like to get there like 15 minutes early so that I can just like sit and chill and I don't have to worry about being late. I woke up a little bit later. I snoozed my alarm, not gonna lie. So I'm not like running late, but I'm also trying to stop at Starbucks, obviously. So I'm just a little worried about the time. I won't have any time like once I get there. I'm getting there like right on time, but it's a long drive, a way longer drive than yesterday, and what I have for psych clinical normally. So I just wanted to update you guys, tell you guys what's going on. I am about to pull into the Starbucks that I ordered from. I always put in an online order so I can just run in and pick it up. And so that's a tip I have for you guys if it's like the morning and you're in a rush. And then another tip I have for you guys, which I forgot to tell you, was in the mornings I always put my AirPods in and I put on a podcast, and that is something that tremendously helps me wake up in the morning. Like I've said throughout this whole vlog, I am not a morning person whatsoever, so anything I can do to help my body and brain wake up in the morning and get me out of bed is a godsend. So putting on a podcast is one of those things. I'm obsessed with podcasts. I literally listen to them like my entire drive. Okay guys, I just got done with clinical, and guys, it was amazing here. I got to be on the ECT unit, which is the Electroconvulsive Therapy unit, which was super crazy. I got to see so many people get shocked. I got to talk to so many people, patients, about their different disorders and why they were getting this treatment and what it does for them, and it was so interesting. So basically they like shock the brain with these little paddle things they put right here. They put the patient under anesthesia and then they shock them. The shock lasts, or the shock causes a seizure, and then the seizure lasts for less than a minute normally. If it lasts any longer, then they have to give a medication to stop the seizure because that can be dangerous. They're not breathing during it. It was very interesting. They had to hyperventilate the patient before shocking them, which I've only heard about hyperventilation and only in situations where you're cleaning a trach. So it was very interesting to see the hyperventilating process. Like they literally, like just like you would think someone's hyperventilating, that is what they do to you. Like they're literally bagging the person to where their chest is going like this. Like they're literally going, but they're not doing that. They're bagging them. And then the doctor comes over, puts the paddles there. They tense up, they have a seizure. And then they're out of it in that post-ictal phase for however long, different times for different people, and then they go home. They're there for like an hour at the most. Like it is crazy. It's outpatient, most of it. I did have one inpatient come in to do one, but it was very, very interesting. It was nice to see a more medical side of psychiatry because everything else is just med passes. They don't do IVs. They don't do, like, they do injections sometimes, but they like their patients to be as medically stable as possible. So it is very, very fun to see. They have to put in IVs. They're going into, it's like a procedure room, but it's like an OR basically. Like they're putting the patient under general anesthesia to administer this shock. So I just liked it a lot, honestly. And they go from like 7 to like 11:30 and then they're done for the day. Sounds pretty dang nice to me. But no, those were the ECT nurses. And then I went on another unit that was just like a regular behavioral health unit. It was very interesting. I got to do an assessment for a petition patient, basically someone in the community, in their family, whoever has petitioned the court to involuntarily keep them in the psychiatric unit. So this facility that I'm at is one of the only facilities in Tucson that has a courtroom in the facility, which is required to keep petition patients. And it's a very complicated process when a person gets petitioned, because obviously you're taking away their rights because they're being involuntarily admitted. So it is a lot of work, but it's crazy to see how many petition patients are here. Like it's almost completely filled with petition patients. But this woman got petitioned And I got to watch her whole assessment and intake and admission onto the unit, which was really interesting. What else? I got to go on the pediatric unit. They have a peds unit here. You guys. Teenagers are scary. Let me just say it. I'm just gonna say it. Teenagers are scary. They kind of scare me. I was really excited about the kids unit because, you know, I love kids. I want to be a peds nurse. So I was really excited to be on that unit. Then I got on the unit. The unit I got put on was mostly teenage girls. Those girls are scary. Oh my gosh. Like, the nurses there have to be so stern and strict with them. They're literally like parents to these kids, and they have to set like strict boundaries and strict limits, or else these kids will literally walk all over you. So basically, if I would ever had to want to work in a psychiatric pediatric unit, I would either have to be on like the little kids unit area, or I would have to get a much thicker skin and like just be able to like put my foot down, because like these girls, I am not mentally strong enough to like keep them in their place. Like, they will walk all over me. And the nurse I was talking to, she was like, yeah, like, I had to learn to be this way. Like, when I got here, they would walk all over me. Like, they would just do whatever. And I had such a problem with trying to talk to them and, like, trying to get them to, like, listen to me. And she was like, it was, like, a learning process of, like, learning that I have to be stern. And it took, like, seeing things, like, witnessing things on the unit that, like, finally made her realize, like, okay, like, this is for not only my safety, but also the safety of the patients on the unit, that I have to be stern, I have to put my foot down, I have to set limits for these kids. So that was one very big eye-opening experience for me. The teenagers I find very intimidating, which I know I shouldn't, because I'm gonna be the nurse, I'm the authority figure, but they're very intimidating. And like, reading their like histories, I don't know, I need to work on, that's something I need to work on. Obviously I can't be intimidated by children, especially if I'm going to be a peds nurse. I have to be able to be authoritative and to understand my position as a nurse and be confident in it, which is all going to come with time, obviously. But it's definitely an eye-opening experience to see that, like, I'm afraid to talk to these kids, and I shouldn't be, because I'm their nurse, you know? I will be their nurse. So that was interesting. But it's also sad to see, like, little kids with these mental health disorders, and to think like some of them are genetic, just happens, but a lot of them come like from abuse and like their home lives. It's just really sad. It's really sad, and it takes definitely an even specialer, I feel like more special kind of person to care for behavioral health kids, because let me tell you, it's a whole different kind of world on the peds ward. My goodness, whole different kind of world. Not to say I'm not interested in it, and not to say that I'm not up for it. I was definitely very interested in the pediatric unit. I was very excited to be there. But I don't know, guys. It was crazy. Oh my god, there was a med student in the ECT unit. My god. You guys, worst encounter with a med student I've ever had. He was so arrogant, such a know-it-all, and had to correct me on everything, even though what I was saying wasn't even wrong. He doesn't even know what he's talking about, guys. He literally said that Demerol was a steroid. Third semester medical student said that Demerol was a steroid. If you guys don't know, Demerol, it's not a steroid. So that was just upsetting me, because, and he was also like making kind of like sexist comments, which were offending me. Slightly offending me, but we're supposed to respect our doctors. So I let it go. Just kept my smiling little none of this affects me face on. But yeah, that is what I had to deal with today. And then if you guys want me to talk about the vaccine clinic, which I know I didn't do, it was so great, guys. I get so nervous to the point where I'm literally shaking when I'm trying to do my skills because I just feel like I don't know what I'm doing, even though I know what I'm doing, you know? So even though I had already done a vaccine clinic, I came and I was like, oh my God, I feel like I've forgotten everything. Like, how do I give an injection? I don't know. And so I was freaking out. I was like shaking so much. And it got better. The more I did, the more confident I became in my technique, like knowing the steps to my specific technique for giving an injection, because there's a lot of different ways people hold the needle, like prep for it, everything. Like, you just have to get in your own routine and whatever works for you, and then just stick with those steps in your head and just go 1, 2, 3, 4, 5. That was the easiest way for me. And I think one of the things that made me so nervous about it was the fact that I didn't really have that routine. So I was watching multiple people give vaccinations. They were all doing something different. I was like, which way do I do it? Like, I don't even know like how I'm about to go about this. And then like the first time you are like, okay, which way is gonna work best for me? Like, you have a needle and you're next to your patient, you know? So like it's nerve-wracking to like be like in that situation and being like, okay, is this gonna work better for me? Is this gonna work better for me? Going through a car window just makes it like 10 times more difficult. I don't know, guys. I feel like I should be better at that, and I don't know. But after a few times, I started to get less and less shaky, and I was just going for it, getting my routine down. But right now I'm gonna go because I have a long drive home and I want to get out of these scrubs. Okay, I'll see you guys later.